So let's turn now to Meg Hansen. And Meg and I are going to reflect upon what she has learned, what we have learned, all of us, about lessons from the pandemic, our experiences and our lessons. Meg Hansen, get us started.
Hi, Bill. Thank you for having me on the show. I hope you had a very happy Christmas, and I'm also very grateful that you're here and that we're talking and reflecting after 2 years into the pandemic. I think it's important, as you said, to be mindful and reflect on the lessons that hard things teach us.
You sent me a couple of notes, good notes, and the first one is about what we've learned about public health and political decision-making. Get us started.
So the first thing that I would like to bring attention to is the fact that it has been 2 years since COVID-19 broke out, and public health authorities are still doggedly focused on prevention as the sole policy response, having abandoned clinical treatment altogether. So we know that COVID is airborne, and really now it's not a pandemic anymore so much as it is endemic, which means it is in the air and it is with us. It's not going to go away. So a zero COVID strategy, which is still in place, especially in a state like Vermont, where the idea is to eliminate COVID altogether, that is not possible with just prevention alone, whether that's masks or social distancing or vaccines. We know that it's not possible. So it's really important that we treat COVID. And that is the only way that this can be held under control. This has become so politicized that we're just not able to, even have an honest discussion about the fact that treatment is the way forward. The only drug that has been for a long time, until 5 days ago, that was approved is the remdesivir, which in itself is very politicized, and it doesn't help. So it is given later on when you're hospitalized. The studies show that it's not always effective. We need drugs when you test positive. We need drugs to help you right away when you have a mild or moderate disease that stops it from progressing into hospitalization. 5 days ago, the FDA has given emergency use authorization to a drug called molnupiravir by Merck, which is, again, shrouded in so much politicization because Merck is also the same pharmaceutical giant that won a Nobel Prize for a drug called ivermectin, which it's like you can't say that word anymore. It's become so maligned. Whereas drugs are the way to help people. I mean, you need to treat people. We also don't talk about the fact that even if you, for those who recover from COVID, at least 25%, some numbers say up to 40%, develop something called long COVID, which is a chronic condition. And without treatment, there is no way that we can return to a normal, healthy, happy society where we're all seeing each other and interacting in the way that God has created us all to be.
But it seems to me that we are so divided today as a society here in Vermont and throughout the nation and throughout the world that whatever one's politics might be, every issue has the risk of becoming politicized, and we must strive not to let that happen. Tempers are flaring, emotions are running high. I don't know a single business organization, including government organizations, that aren't saying they're short-staffed, they could use more help, and that's on the supply side. But remember, every person who's producing something is also buying something or receiving something. And the result of that is that as we go out to purchase a service or a good, we have a hard time finding it. Many shelves are empty. Why is that? We get frustrated then as customers and as suppliers. And that's the signs of a breaking down of our economy and ultimately our society. We must correct that. And the way we start by correcting it is understanding what's happening. Now, Meg, as we go back to you, you mentioned a certain Merck medicine that no one dares to pronounce. I wouldn't dare to pronounce it even when I knew what it was. So explain a couple of these terms which you've used today about the new medicine.
Molnupiravir. It works similarly to, as I said, ivermectin, in that it stops the virus from replicating, and that is really the point. With COVID, the virus SARS-CoV-2 has such an exponential rate of replication that our body gets completely overwhelmed. So if there's anything that would be extremely, extremely beneficial in preventing progression into severe disease or complications. So, something as simple as a nasal wash or a mouthwash with Listerine or Scope has been proven to be really helpful as soon as you test positive to do that, because, the nose and mouth, that's the area where all the viruses enter our system. It's an airborne disease. So I think that, why aren't we talking about that? I think for me, when you ask, Bill, what are the things that we've learned, that I studied medicine. I went abroad and I went to med school and I got a degree called the MBBS, which is the British equivalent of an MD, though I don't practice medicine because it's not my calling. And what I'm discussing here is not in the capacity of a physician, just as someone who's really studied these issues and is written about health policy and its sort of ramifications on society. It's really been heartbreaking to me to see basic tenets of clinical practice and medicine become so politicized. I think that is really heartbreaking. The fact that we can't even talk about, medicine or how to prevent the disease. The standard advice, medical advice was, when you test positive, go home and recover on your own. And I think that is so damaging, so debilitating, because, as I said, you can develop long COVID, you can get hospitalized. Not even talking about something as vitamin D, which help, or other vitamins that boost your immune system. We can't even talk about that. Or we don't talk about the fact that naturally acquired immunity. So let's say you get COVID and then you recover from that. That is, that protects you to a great extent. But in all the literature and all the public health discourse, we pretend like it doesn't even exist. For every other disease, that when you get naturally acquired immunity, that is strong and robust, better than a vaccine in many, many cases. But we're dismissing it as if it doesn't even exist, and I really can't wrap my head around that. And the other part is indiscriminate policies, like the lockdowns, school closures, universal mandates. The underlying the proposition is that COVID-19 is similarly fatal to everyone, when it is not. We know that in increased age and chronic conditions like obesity, heart disease, COPD, these things make you especially vulnerable to the disease, whereas if you're younger and healthier, you'll have a different reaction to it. It's not the common cold. I've heard people say that. It's not. This is a serious disease, but it affects people differently. And your health profile, your age matters. But we aren't even able to talk about that. It's just one size fits all. There's no science behind that. There's no logic behind that. And so even 2 years later, when we talk about public health is all COVID all the time, but we are not talking about it seriously. No serious discussion would, negate naturally acquired immunity, would abandon clinical treatment altogether. This is not a serious conversation when we do that. And at the same time, we are completely disappearing all the negative consequences that derive from just having all COVID all the time. We're not talking about mental health deterioration that came from the social isolation. We're not talking about the effects on children that happens from disrupted schooling, which continues to today. So I think there's a lack of honesty and skewed logic or absent logic in our conversations about COVID and how that's informing the policies that have been enacted in response to it have really caused so much damage. It's really even eroded trust in the medical profession, in public health authorities, and that is very problematic when you think about our society and what keeps us together. We need to have faith and trust in our institutions. And so I think all these other factors have really been things that I've been thinking about and worrying about when I think about the future.
Good insights.
You have to weigh the risk and benefit of every medicinal product, whether it's a vaccine or a drug. But we aren't having that conversation. We are just not having that conversation. It's important to have informed decision-making, which means we need to be really open and transparent and candid about what are the side effects or adverse effects that have showed up while testing the drug, and let's talk about how we can go forward with it. So you talked about long COVID. Long COVID is a syndrome, a condition that has been identified after a person recovers from active infection. So now the virus has left their body and they've recovered from it. They continue to experience symptoms that are persistent. So a cough, for example, brain fog, which is, you're confused, a state of being confused. A lot of people experience this when they have the infection. Feeling very tired, a lot of malaise, feeling like the life force has been sucked out of you. These sort of persistent symptoms, and there's a whole range. It really varies from one person to another. But this gamut of symptoms continue just indefinitely. And that has been identified as long COVID. And at least 25% of people who recover from that get it. So in this case, this is a side effect of not treating it. There are side effects of whatever drugs have been given emergency use authorization. So, for example, Merck's new drug, it has not been approved by FDA, so the FDA has not approved it. They've just said we need something right now. 2 years later, they've realized we need something. So for mild to moderate disease, they say you can quickly take it now. But what are the side effects of that? No, I don't know that. And obviously Merck is not advertising that. Unfortunately, neither is the FDA or CDC willing to have an open conversation about it, which really baffles me.
Meg, I'd like you to comment on anything we've said so far, plus your further thoughts. Keep us going.
When you started, you talked about the supply chain issues and labor shortage, and I talked a lot about health policy. So I think it would be nice to make a connection between the two and see how COVID response policies have any impact on the labor shortage and the supply chain issues that are happening. It's not a simple answer as to why so many young people, so many able-bodied people have dropped out of the workforce. Goldman Sachs calls it a perfect storm of various factors that have significantly reduced the supply of workers. But one of the factors is the fear of COVID. And that is actually when they drew up a chart. I mean, there are many factors like state and federal benefits, early retirements, a switch to self-employment. But one of the major factors is a fear of COVID. And I see this as really problematic in terms of returning our society back to a healthy normal. We've heard a lot about how this is the new normal. And that's fine, we have societies that change. We respond to things that come up. But if the new normal is not healthy, if it is one in which people feel isolated and turn to substances and other aspects to fill that void that has been created because of a lack of interpersonal connection, which is so integral to human society, then I don't think that's a new normal that we should embrace. Unless we eliminate the fear of COVID, I think every other aspect, every other issue is secondary. What is the role of the media in hyping up the fear and fostering fear amongst people about COVID is really counterproductive. There's a new variant that's out. There's always going to be new variants because this is a very highly contagious virus. And as I said earlier, it's endemic. So it is with us. It is not going anywhere. The way to keep it under control is by treating it. And so if we focus on aggressive treatment, early treatment, and teach people how to stay healthy, how to, do little things like take vitamins or have a nasal wash or, little factors that we can do to empower ourselves and protect ourselves, that message is unifying. That message allows us to live the lives that we want to create for ourselves and our families: freedom, liberty, unity, independence. That is how we should, I would say, move forward in 2022. Get rid of this fear factor. We don't need fear. We don't need to fear COVID anymore.
It seems to me, Meg, that over the course of our history here in America, and same throughout the world today and throughout history, that the fear creates the opportunity for some form of government to take more authority, more power over the lives of individuals, and it tends to make people more willing, individuals willing, to surrender their individual liberty. Your thoughts on that, and what do we do about it?
Absolutely. When you are afraid, then you want to feel safe. And how do you feel safe when this absolutely unprecedented pandemic sweeps the whole world? So obviously it would make sense to turn to the government, to authorities in power. And, human nature is such that whenever there's an opportunity to accumulate power and get influence over other people's lives, there's no judgment in that. It's just how we are made. Once we get that power, we don't want to let go of it. But how can you live a happy, wholesome, fulfilling, meaningful life if it is driven by fear? We talk about fear of anything. People have fear of public speaking, and I'm not trying to trivialize the fear of COVID, because people do die, especially if you have risk factors. But there are many things that can kill us. Human beings, we are very vulnerable to all kinds of factors, whether it's cancer, whether it's an automobile accident. Death is something that we cannot escape. We cannot escape that. There are so many things that really terrify us, but it is up to us as individuals to say, no, I'm not going to let fear determine my actions. I'm not going to surrender my own power over my life, agency, which is my ability to live the life that I want, to somebody else, because it's not needed. It's really not needed. 2 years on, with COVID, with the medicines, with what we know, there are so many people in the healthcare world that have been working really hard and coming up with all sorts of treatments, listening to the media, and by that I mean the mainstream media that is focusing on variants. I say that's the way to give up your power. So take back your power, own it, and say, no, I'm going to live a wonderfully fulfilled life. COVID is not the end of the world, and I'm not going to let anybody make me believe that. I think this is a decision that we all have to come to on our own, and that really is the bedrock of a free society, a society in which individuals decide, I'm going to make the decisions that are best for myself and my family, and if there's a mistake, just like you said in the beginning, Bill, I learn from it, I grow from it, I change. But I'm not going to surrender the responsibility or the independence for a false sense of security, because it really is a false sense of security. Vaccinations don't prevent infections. Masks are not perfectly preventative. We know that whatever drugs come will have some adverse effects. So there's no bulletproof answer to anything. This is the messy world that we live in, and we have to navigate it. But in order to do that, we need to not surrender these important decisions to a government, which is populated by people who also really don't know. They don't know much more than we do.